So today we're going to be talking about breathing. So we've done pulse, blood pressure, and now breathing. And the first lecture was on the heart, but I think that was probably a bit comprehensive, so I'm trying to break that down. So just like the start of the other two, we're going to just start with a quick practical. So firstly, it's a common thing which I think a lot of people might know, but does anybody know about the recovery position? The recovery position. So putting somebody in the recovery position.
Slightly to the side.
On the side.
Yeah.
Legs over.
Oh yeah. Okay. So is it okay if we just get somebody to just demonstrate? So if we get two people, one person, if you just pretend that you're, if you're unconscious or somebody's found you and you're in a difficult situation, and somebody else who thinks that they can help, just to show us what is the recovery position. Now I think this is going to be the conclusion actually of today, but we're going to go hopefully full circle. So can we just get one volunteer? Anybody? So thank you very much, Noshad Uncle. So if you can lie down, imagine that you're maybe unconscious. Okay, so first of all, hands up. Who's heard of the recovery position or who's kind of been taught it before? So 1, 2. Anybody else? No? Okay, so this will be really useful, so maybe we'll be able to learn from it. Okay, so imagine somebody's unconscious. So what is your...
We have to clear the hazard.
Okay, fantastic. So number 1 is just clear the area of hazards. And it's important to see that because you just carry on, I'll just talk through.
Yeah.
So carry on, Noshad Uncle. So it's important because obviously if somebody's unconscious, you don't know why they're unconscious. There could be blood around, there could be some bodily fluids, there may be electrical cables, anything. So it's really important that before, instead of just rushing straight in, that you also regard your own safety. If you can, then it'd be great if you had a pair of gloves. We'll talk through this. It's important that if you have a pair of gloves or something, it'd be great. If not, then obviously, then you just go ahead.
Why do you need a pair of gloves?
Well, a pair of gloves is important because actually when you're seeing a bystander on the street, I mean, they've passed out. So sometimes it's situations that maybe somebody's been drunk and they've passed out. Sometimes they may have been injecting drugs and they've passed out. The thing is that in a situation where somebody's fallen down, there's probably a fair chance that they may be bleeding from somewhere. And there is risk of contamination. So it's not a big must, but just if you have the opportunity, just to also protect yourself, you can do that. But I mean, you don't need gloves. It's just if you have it in an environment, that's fantastic. Okay, so this is perfect. So you can do the recovery position in a few different ways, but it's basically the same principle. So we've got somebody who's lying on their back, and potentially we've looked at hazards, we've come across, and we've moved them onto their side. So this is a skill which is taught to a lot of people, especially people if they see somebody who's diabetic or sort of epileptic, and if they've passed out, this is the main first aid that they would teach you, a very basic first aid. And surprisingly, this actually, just turning somebody on their sides, it does actually save lives. But why is that? Why do we know why? What about the recovery position, Noshad Uncle or Shabir Uncle? Do you know what the purpose of the recovery position is?
Well, 2 things. One, that to make sure that their airways are not blocked. So if they vomit, they don't choke on their own vomit.
Okay.
And laying on the side and keeping the airway straight so they are able to breathe.
Yeah, brilliant. So actually the purpose of this is to make sure that you're protecting or taking care of the person's airway. Yeah. This is, after everything is said and done, basically the point of the recovery position is to protect somebody's airway. And we know that if somebody's unconscious, as Shabir Uncle was saying, that there could be vomited inside their mouth, there could be they could be gagging, their tongue might be blocking the back of their throat, a number of things. And those things, if you don't change in seconds, then they will die, because without breathing, you go. That's fantastic. Thank you very much. Okay, so we're just going to go to the first thing. So today we're going to just briefly talk about the parts of the respiratory tract, assessing breathing, signs of respiratory distress, and airway obstruction. So we're going to end as well with the recovery position. So firstly, we're going to talk about parts of the respiratory tract So, I mean, in the broadest sense, we're talking about the respiratory tract. So we're talking about the respiratory tract, everything from the outside over here, from the mouth and the lips, all the way down to the lungs. So we're including things like lips in your mouth, the nose, the tongue, the voice box, the trachea. The trachea is this big main airway that brings the air down, yeah? The bronchi, which are these smaller parts here, and these are the main primary bronchi, then you've got secondary bronchi, then you've got tertiary bronchi. It's like branches of a tree, really, that goes into the lungs. And they end in these little sacs of air, which is the alveoli. And then you've obviously got the chest wall, which is not really part of the respiratory tract, but obviously is part of the mechanics of breathing. So we can divide this roughly into upper and lower. So the upper respiratory tract, and if you may have heard, someone's got upper respiratory tract infection or a lower respiratory tract infection, there's generally distinction about whereabouts in this tract this starts and stops. So I want to talk a little about assessing breathing. So I want you to have a look at this picture of this person who's really struggling with their breathing. And let's just get some ideas about what makes us think this person might be struggling with breathing. You're assessing this person, somebody you're seeing either on the street or somebody who's, in your house, maybe a relative, somebody. You probably all have come across people who have had difficulty with their breathing. So not just this picture, but imagine back to the people who you may have come across, who you've seen actually struggling with their breathing. What kind of signs can you tell you that this person is struggling from breathing, or the person that you remember?
We can see, though he may be thin,
Yeah.
we can see the bones, so that shows that, there is some sort of activity to keep himself.
Absolutely. So what we're talking about there is the respiratory effort, yeah? So you can actually see indrawing in between the ribs, yeah? Now, this means that the muscles in between the ribs are really working very hard to try and, the chest wall is really trying to move to try and bring the breathing. So we're also seeing what we call effort, okay? Signs of effort, yeah? So this is called intercostal recession. And even if it's just below the ribs, it's called subcostal recession. But the point is, you can recognize it. Anyone can recognize it, yeah? But a very important point is to be able to see the chest, okay? What else are we seeing here that gives us an idea this person is struggling with their breathing?
Is it crouching?
Yeah, tell me a bit about that.
It seems like he's struggling to take the air in as much as there's pressure on his chest. Yeah. He's struggling to take the air in as well.
So we're talking about his posture,
yeah?
And that's a really big telltale sign, okay? If you have just run, 200 yards, 200 meters, maybe 400 meters sprinting, or if you've done a marathon, what do these marathon runners do when they're tired? When you see them finish the London Marathon, they're like this. They're letting themselves down, or maybe on a table, like this, or maybe against a wall. They're like, now, why is this? This is a natural position. You put your arms out in front of you, because then the pectoral muscles here actually helping to pull the chest in and out. So it's a natural position that you can just see from somebody's posture that they're struggling with their breathing. So, sometimes people will say with the breathing, you just, how fast are they breathing? How slow are they breathing? But actually there's a lot more to it, because people, they don't just go from, breathing normally to breathing fast. There's a lot of whole changes. And if you can recognize this, if you're in the house with somebody, who suffers with asthma, who suffers with breathing problems, who's got an infection, these are the kind of things to start looking, hold on, yesterday they were lying down, today they're always sitting up, they say they can't go to sleep because they're sitting up, they can't sleep while they're lying down, they have to sit in a chair. And that gives you an idea that, hold on, the posture tells us something about, their breathing. Yeah, I don't want to go next. So what else? Any other signs?
Out of breath?
Yeah, what do you mean by out of breath? How can you tell?
Well, when you hear somebody talking,
Yeah.
And is out of breath, you can hear that.
So, like they're not able to speak in full sentences,
Yeah.
or they're gasping, so they seem out of breath. Yeah, so that's a very good sign. If you call the ambulance and you tell them somebody's here, they're having problems with their breathing, and if you tell them they're not talking in full sentences, then they know they need to come, because that's a really good sign. People can shorten their sentences. You'll see that, first of all, they'll talk in sentences and they'll breathe between. Then they'll shorten their sentences, and then they won't be able to talk in full sentences, and that's really not natural. And that's happening because, they're struggling with their breathing. I won't go too longer, but maybe one or two more things.
Colour.
Colour. Tell me about the colour.
Well, I mean, they probably a more red face.
Yeah.
Yeah. Or if somebody is researched, they could be very pale.
Yeah, absolutely. So, I mean, colour is a really important thing because, so what's useful, I mean, it depends in children, it depends in adults, but yes, two main colours you're looking for. So one is that there's pinkish, hyperemia, the blood circulation is trying to sort of get overactive. The other one is maybe a bit blue or cyanotic, particularly with children, look at blue around the mouth or anything like that. And yes, pale is also a good one. Any other last ones before we go for the reveal?
Is there a bleed as well on his chest?
No.
Is that to do with like stabbed or something?
No, that's just the
main
image.
reason why the poor man was thinking like that.
It's good holistic observation, but I think that's just the drawing actually. So look at his mouth, look at his face. If you take away everything else and just look at his mouth and face, if you just had a picture of this man's mouth and face, you'd probably be able to tell that he's struggling with breathing. And what things can you tell from his mouth or face that he's struggling with his breathing? Yeah, okay, absolutely.
His face looks strained.
Looks strained, yeah. So we said his cheeks look a bit, in his mouth, his face looks strained. So this is called pursed lip breathing. So if you imagine you've just, run a long time or someone's struggling with their breathing, they don't often breathe like this. They breathe like this. And they're breathing against this pressure. What are you doing there? You're putting your lips together and you're making pressure. Because often if you're having a problem with your airways, the airways are being narrowed. One way to counter it, naturally, is to push against pressure. Then it tries to open up the airways. So somebody's breathing through pursed lips like this. Yeah, that's one idea. And the other thing is, if you look at his nose, often, and particularly with children, a very good sign in children, because children don't often complain when they're struggling with breathing. And you'll see a little video later. Nasal flaring. So they go. And when they breathe in through their nose, you'll see their nose are flaring. Normally when you breathe through your nose, you don't flare your nose, your nostrils. So that's quite a useful sign. Okay, so what I want you to do is have a look at the breathing in these few people. They're all children actually, so sometimes it's a bit distressing, and I apologise for that. But have a look, and this is really important. If you're a parent, then it's really good for you to be able to recognise, when your child is in a bit of distress. So have a look at the breathing here. Now you can see what Mullah was saying. There's ribs you can see very clearly here, and it's really indrawing in between. This is intercostal, and just below the ribs, subcostal. Look at the nose is permanently flared, the nostrils. Look underneath where the trachea is, on top of the ribs and the neck. You see there's a little gap coming in. It's appearing and disappearing underneath the neck. Now these are signs of respiratory distress for a child. There's another one coming up with another child. And in children, it's really important to be able to recognize these things because, as I said, in children, they don't talk. If you looked at that boy, he's not shouting, he's not screaming, he's actually just very, very calm. You look at him and he looks very calm. Now this child, you can see head nodding. Now this is really bad respiratory distress. And actually, we're talking about posture.
Are these real?
Yeah, this is real, yeah. So here you can see that because the accessory muscles are being used, the neck muscles are being used, his whole head is bobbing forward and backwards, and you can see the chest coming in and out. And this is called paradoxical breathing. You're not going to see, it's very unlikely that you'll see cases like that, but even from the outside, when you're not looking at the chest, you can see the head bobbing there. Now, the problem is that, especially in children, they're not going to complain. They're going to just be concentrating on their breathing. In fact, you want to keep them calm and, and try to facilitate that, but facilitate their breathing, what they can do. But it's important to be able to recognize how ill they are. So we're looking at a few other things. We also talk about rate, how fast they're breathing, which we talked about, the pattern, which we talked about this. When you look at the stomach coming out when they're breathing rather than going in, this is like paradoxical. And the other thing is added noise. What kind of noises can people make when they're struggling with breathing? Wheezing, yeah.
Groaning.
Yeah. Grunting, groaning, yeah. Now, I'm going to give you 3 sounds, and I want you to tell me whereabouts. This is all to do, noise is often to do with blockage or obstruction. So I want you to just give me an idea. We talked about upper respiratory tract, lower respiratory tract. I want you guys to vote, where is the noise coming from? So we've got 3 options. One is from the mouth, one is from the throat, and the other is from the lungs. Okay? So listen to this one. Where's that coming from? The mouth, the throat, or the... Okay. So this is the very upper airway. So yeah, mouth/throat. This is the upper throat. This is called stertor. Yeah. This basically means if you see somebody unconscious, they're diabetic, they're epileptic, they've fallen on the floor, and you're hearing these kind of sounds, it means that you need to get them into the recovery position, because probably something in the upper airway, maybe something is up there. You need to move them so it can come out. Encourage them like this, because if they're unconscious, they're not going to tell you. They're not going to be saying, in terms of posture. If somebody's conscious and there's choking, they will go like this, universal sign, and they'll grab their throat. But if they're not conscious, you've got to also hear. And if you can hear those sounds, it doesn't mean you leave them there, oh, they're breathing. No, it means you have to get them on their side because something's obstructing. The second noise, tell me about this noise. So I'm trying to do a wheeze, actually. So where's wheeze coming from?
The chest.
Yeah. There's a wheeze is coming from the chest. Now the thing is, wheeze is actually quite musical. Yeah, you hear these other sounds, they're like one note, but the wheeze is like multiple different small notes, and that's because all of the multiple small airways are being blocked, and you're getting little whistling from each one of them. It's not one whistle; it's like multiple whistling. So that's why wheeze is supposed to be a musical sound. So this can happen if somebody's having an asthma attack. If somebody's having an asthma attack, they're not going to go like this. They're going to have wheeze, which tells you it's coming from the lower airway. The last one. Sorry, it's a bit distressing to hear sometimes. It is actually a distressing sound. It's very high pitched.
From the throat.
From the throat, yeah, from the larynx, from the voice box. And this is really important to recognize, because if somebody's choking, then, if somebody's conscious and they're choking, or even if they're a child and they're having a problem, if they're having, for example, they've had an allergy and they've had some swelling of the airway, it's not going to be, the upper noise, it's not going to be the wheeze, it's going to be this. And it tells you, the reason I'm saying this is not because I want you to all be, clinicians, but I just think it's useful to get an idea when you're looking at somebody. You can actually tell a lot, because if they've got wheeze, okay, well, are they asthmatic? Do they need an inhaler? And that's a really good thing to just tell somebody who might be coming, Or is it that they're having, if they're choking, if they've got something in the upper airway, then you need to do something, quickly. So that's the reason why I'm just sort of mentioning the difference between these things. So we talked about these things. So these are the signs of respiratory distress. Added noises, wheeze, stertor, and stridor. So stridor is the high-pitched from the larynx. The stertor is the kind of the snoring, or from the mouth or the tongue. And the wheeze is obviously musical from the lower airways, okay? We talked about the other things in terms of rate and effort and pattern. So when we're talking about airway obstruction, and this is kind of where we're going to finish today. So there's a few situations which actually you may well come across in the community. One common thing is allergy, anaphylaxis. And if this happens, then it's very important that we have an idea about what to do or what we can do to try and help them. Choking, that's a very common one that people would see in the community. And there's 2 scenarios actually. Somebody's conscious and somebody's unconscious. If somebody's unconscious, the point is to try and prevent them from choking. Because they may not be choking, but how do you know that if they're unconscious that they're not going to start obstructing the airway? Because anyone, when they're unconscious, they lose the tension in their muscles, and then that means that the tongue then rolls back, the airway then relaxes, and that means that they can't keep it open. You have to be conscious and alert to actually keep it open. When you're sleeping, people are a bit less conscious and they snore, they're more likely to snore, but they still are some level of consciousness. And when they're even more sedated, if anyone goes to have anesthetic, they will never leave them to breathe by themselves. So we'll always support the airway, because once you're sedated, then your likelihood is that you will start choking yourself. Also, if people have had drugs, if they've had alcohol, this makes their conscious level even lower. So then if they fall asleep, the likelihood is that they're more likely to snore, more likely to cause obstruction. If somebody's passed out from alcohol, very commonly they would have these extra noises, that they were definitely at risk of choking. Their stomach is completely full. Maybe they might vomit a little bit, you know. And the final thing was asthma. So, I mean, I wanted to just, we're just kind of picking about what we can really do. So it is useful to talk about anaphylaxis. It's useful to talk about asthma. But I think today I wanted to end on just the recovery position, because we're talking about choking. I'm not going to today tell you all about, you know, how to manage somebody who's choking, who's awake, but at least if we have an idea about the recovery position, then if somebody is unconscious, even if they're not choking, it is really, really important. If they're breathing, you put them in the recovery position. If they're not breathing, of course, then it's CPR, or, you know, check the pulse and everything else. But if they are breathing, then you have to get them into recovery position, because that potentially will save them. Yeah? So I'm going to go through the recovery position, and that's what we'll end on today. And then we can perhaps revisit some of these other topics, you know, a bit later. So I need one volunteer. Okay, Ali, thank you. So if you lie down on the floor. Okay, that's fine.
Is this the recovery position?
That's not, no.
Whether you're taken
You change my position.
So if you start off on your back, what we'll do is we'll get you into the recovery position. So the thing we're teaching people is to get them into the recovery position, okay? And it doesn't really matter on the size. You should be able to do it in a few different ways. So there's a couple of different ideas about how to do this. Some people say, you know, if they're there, the first thing, which was absolutely key, was to just check the surroundings. You know, check you're not going to go slipping on some bodily fluid, not there's any electrical cables, that there's nothing that's fallen down and hit this person, and maybe there's something which is about to fall on you, anything like that. So it's important to move things away. If this person has epilepsy, or they've just fitted, or if they're just about to fit, then you also need to keep it clear, because if they do start fitting, you don't want them to injure themselves, fracture anything. So that's what's really important. So first thing is just make sure the area is clear. Second thing, people say if they've got glasses, and you can take off the glasses or something else like that. And usually if they've got a hand like this, you can pop their hand like this, and then put the glasses or something in their hands like this, so they don't go and knock the glass in their eyes or anything like this. So the other thing you can do is then you pop the hand over here, okay, and you put this one knee up, okay. Now this whole thing is just 3 steps, yeah. So what you're doing here is you're making yourself some levers, because, you know, mashallah, Ali is, you know, quite tall, and I won't be able to lift him. And with the food, yeah, absolutely. So, you know, you don't want to strain yourself, and people can be of different sizes. Even a young child can help to put somebody, an adult, a parent, in the recovery position. So this is why it's useful. And then what you do is you take the 2 levers, so over here, one hand over here, one hand over here, and you turn them over onto their side. So if you come over like this, okay, brilliant. Now, ideally the position for the neck is that if you pull the neck slightly up like this. Now the reason for that is that when you pull the neck up, it stretches the tongue and stops it from going back in too deep. You know, there's a few other things you can do with the airway, but essentially this is really the recovery position. So it wasn't very hard. You did 3 things. You observed, you made it safe. Second is you put these levers up here, and third is you turn them over. But this is the kind of thing, if somebody's unconscious, then if you have to wait 45 minutes for an ambulance, an hour for an ambulance, that's fine. If you see someone on the side of the road, maybe if they've passed out because of alcohol or whatever, an epilepsy, very commonly afterwards they will vomit. And if they're not in this position, then that's their life. And you can imagine, you know, 30 seconds of doing something like this can actually save somebody's life. So I don't know if that's appreciated over the microphone really, about how to do the recovery position, but if anyone there knows how to do it, then maybe they can show. But essentially the positions, we started off with lying on the back. We put one arm over the chest and bent one knee up, and we use these 2 things as levers and just pulled him over onto the side. So he's lying on his side, and we're lifting the chin slightly up as well, just to open up the airway. Okay, that's all for today.